Hello class, and welcome to my presentation on telemedicine in today's healthcare. My name is Sandra Tapia, and this is my HTTP presentation for Nursing 435 Section B, Professional Development in Nursing, Southern Adventist University, School of Nursing. The objectives for this presentation are to examine consumers' preference to receive telemedicine, explain how telemedicine can overcome distance barriers, discuss how telemedicine can be cost-effective, discover the use of telemedicine in correctional facilities, identify how telemedicine expands into other nations, and compare traditional office visits to virtual visits. Healthcare has evolved in many ways and forms and continues to evolve each day as technology advances. Telemedicine involves the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient-clinician contact and care, allows for them to give advice, reminders, education, intervention, and monitoring. Telemedicine can help combat many challenges seen in today's healthcare, such as work shortages in both primary and specialty areas. This form of healthcare can be used when patients are faced with distance barriers to help improve access for both acute and chronic conditions. Telemedicine is not only used in primary care settings, but has also positively impacted different areas of healthcare, including trauma and acute care. The use of technology is being used by so many and continues to expand as the public becomes more comfortable with navigating different systems. With this growth, applications in healthcare have changed how, when, and where physicians engage with their patients to deliver quality care. The world of healthcare is ever growing and drastically changing day by day as technology enters our homes and our communities. Telemedicine is used to provide a variety of healthcare options to many different populations. The theorist selected for this presentation was Virginia Henderson. Virginia Henderson developed a nursing theory that applies to all patients as a whole. According to Henderson, important components to health that must be met are the individual's basic needs. Her theory emphasizes the importance of increasing the patient's independence so that progress after hospitalization would not be delayed. The nursing components in her theory are categorized into 14 sections based off human needs. There are 4 major concepts included in the theory, which include the individual, the environment, health, and nursing. Virginia Henderson's theory has focused on the basic needs of patients and has been the key aspect in allowing nurses to deliver patient-centered care by meeting basic needs. Henderson's theory applies to this paper because the nurse assists the patient in the hospital to get better and helps them assist themselves and feel comfortable enough to care for themselves. Nurses have also impacted patients who may not have had access to health care but are willing to try telemedicine. Telemedicine requires the patient to feel independent and comfortable enough to use these services for their health, for the continuation of care. Background and significance. Telemedicine can be delivered through many different approaches. Physicians who have established relationships with their patients can convert face-to-face appointments into telemedicine/video communication consultations. This form provides patients with comfort and security, knowing they have already established a relationship with their provider and have met them in person, while allowing them the continuation of care they want. Another method allows for the same office or group of physicians to care for a patient. This option allows the healthcare professional to have easy access to the patient's diagnosis, history, and labs to be able to provide continuation of care. Physicians outside specific organizations can also have the opportunity to care for patients they may not necessarily know and have treated previously face-to-face. This form of telemedicine does not provide the patient with a previous relationship, which may cause some uneasy feelings toward plan of care. The extension of community health outcomes, or the ECHO program, initially promoted in 2003 in New Mexico, was an early example of telemedicine being used to bridge the gap for rural and underserved or isolated areas of care. With the growth of telemedicine/telehealth in the Midwest, patients and providers were broadened more access to extensive clinical support and new ideas to deliver treatment. Patients vary in many forms, and not one patient is the same. Evaluating patients' needs and accessibility will determine if patients qualify for this type of healthcare delivery. In-person care is not feasible for some, in which case telemedicine may be an alternate option. Review of literature. The articles that were selected for this research came from Southern Adventist McKee Library Database. These articles came from studies that were peer-reviewed and less than 5 years old. Words such as telemedicine, telehealth, benefit, uses, rural, emergency care, effects, and technology were used to narrow these findings to relate to the topic. Telemedicine preference. The use of telemedicine has the potential to change traditional patient-physician relationships. This study, conducted by Welch, 2017, was intended to understand patients' preferences and desires for direct-to-consumer telemedicine. The study that was conducted consisted of surveying a population in the United States with questions that assessed the participants' willingness and comfortability using technology and telemedicine, as well as the expectations held from providers to consumers. A nationwide survey consisting of 4,345 respondents were demographically balanced to represent the United States adult population for this survey. Welch, 2017, collected data by performing a balanced nationwide survey using SurveyMonkey audience. This program allowed an equal nationwide representation of the adult U.S. population and was categorized by gender, race, and education. Survey data was analyzed using R 3.1.1 and SAS 9.4. More than twice as many respondents were willing to see their own provider via telemedicine than were unwilling. Participants that felt comfortable seeing their own provider by telemedicine were a total of 53.7%, compared to 24.5% who felt uncomfortable. Limitations to the study include individuals who did not have access to internet or are unable to use the internet to perform the survey. People may be willing to perform the survey, but due to limited resources or lack of knowledge are unable to perform surveys via internet. Recommendations for future study can include reaching future candidates by sending survey forms in the mail and have them sent back to the corresponding address. Having survey forms to be sent out to primary care physicians' offices could also be an alternate form of having a variety of participants participate for future surveys. Other individuals that may also be included in the survey that could have potentially been missed include those who are not fluent in English. Having a variety of forms in different languages in the suggested above forms could increase the variety of population that the survey targets. Distance barriers. Delivery of healthcare can vary depending on the physician and the patient and what each may feel comfortable with. Healthcare may be delayed in some cases due to barriers that may prohibit receiving it, such as transportation and distance. Banbury, 2018, performed a study to determine the feasibility, acceptability, and effectiveness of the implementation of the use of video conferencing at the homes of participants. Banbury 2018 used the Mixed Methods Appraisal Tool to collect data. 1,634 records were identified, with 17 of them included in this review. Results from the study showed home-based video conferencing to be very feasible to even those with limited knowledge in technology. Access from the home setting was highly accepted and valued with little concern of privacy issues. Technology support and training are needed for facilitators and participants to help with navigation. The limitations of this study include the exact location of users and the different population sample. Recommendations for future study include there be a higher number of participants to be able to obtain evidence-based information. Cost effectiveness. Healthcare prices can skyrocket in a matter of seconds. The use of telehealth has been proven to decrease cost of patient care. Ho, 2014, conducted a retrospective study through the National Taiwan University Hospital, Taipei, Taiwan. The study consisted of patients who were at least 20 years old who received care through the telehealth program at Taiwan University Hospital from December 2009 to April 2013. A total of 576 cases and 1,178 controls were enrolled in the study. Ho, 2014, used an electronic database from the hospital to collect all demographic, hospitalization, and payment data. The diagnosis of chronic diseases were also based on electronic databases. The use of chi-square tests were used to compare categorical data. Cost effectiveness was measured by cost care, cost control, effect case, effect control, with the principal result revealing that the telehealth program was associated with lower cost. Limitations of the study include that this was not a randomized collected study. Secondly, only direct medical costs and intervention costs were reported in the study. Lastly, this study did not use the Q-ALI generic measurement of disease burden. The researcher suggests for future studies to include this test as well as choosing a random controlled study for comparison. Telemedicine in correctional facilities. Telemedicine is not limited to any one particular group or groups of people. Telemedicine has also been used as motivational enhancement therapy. Staten Tyndall, 2014, conducted a study on the use of telemedicine therapy among incarcerated men in a rural Kentucky correctional facility to reduce the use of alcohol among those at risk. The study consisted of 127 rural alcohol users who were incarcerated in a Kentucky jail to engage in brief intervention sessions using telemedicine. Staten Tyndall, 2014, collected data after offenders' initial visit with their supervision officer if referral to substance abuse assessment was mentioned. This assessment consisted of a 20-minute screening session which included the Global Assessment Individual Needs, or GAIN, Cognitive Impairment Scale, and 3 short mental health questions. Univariate and descriptive analysis were used to analyze data. The results of this study showed that those incarcerated and received 3 to 5 sessions of telemedicine were associated with a decreased likelihood to relapse to drinking. Limitations in this study include a small follow-up sample. Another limitation listed from this study is that it was possible that the community supervision office could have been considered a threatening environment, leading to a potentially low number of those interested in sessions. Recommendations for future study would be to include other correctional facilities in other states to have a more variety in results. Telemedicine International. Telemedicine is used not only nationally, but also internationally to reach other nations, including the third world countries. Brooks, 2017, conducted a study to assess how easily it would be to install a telehealth network between deprived sites, particularly in Honduras, and the Medical University of South Carolina. The goal of this study was to make it easy for the pediatric underserved population in Honduras to have access to health education and primary and specialty care. 2 rural clinics in Tegucigalpa and Santa Maria del Real, Olancho, Honduras, were used for this study. Computers with monitors were delivered to both facilities. Medical examination cameras with Logitech BCC950 web cameras were used with video conferencing software installed at both locations. Satisfaction surveys translated in Spanish with comment sections were used to assess connection quality and technical difficulties using a 5-point Likert scale. Descriptive analysis were performed. A total of 3 consults were conducted between the 2 locations, with at least 3 to 6 providers completing the survey with 100% positive feedback with the use of telemedicine in the future. Limitations to this study were the limited number of facilities that were used to determine the effectiveness and the positivity of future use in telemedicine. Another limitation in this study is the weak internet signal in the areas used. Due to being in rural areas, internet access is not always attainable. Recommendations for future study include increasing the number of clinics used and connecting with more physicians for a larger input on ideas and opinions. Emergency care telemedicine. Emergency rooms are always faced with understaffing and high nurse-to-patient ratios. Patients with not-so-severe illnesses and injuries are faced with long wait times if their acuity is not high. McHugh 2018 conducted a study to evaluate the progress of the first emergency care telehealth program in the New York metropolitan area to see if the ultimate goal could be met: decrease wait times and increase satisfaction scores. Patients who presented to the ED with minor injuries and minor complaints were offered virtual visits. These visits were with board-certified emergency care physicians who were located in the area. This Level 1 hospital was able to treat more than 1,300 patients. McHugh 2018 collected data from patients' virtual visits through patient satisfaction surveys. Patient survey response in multiple areas including overall score, doctor's courtesy, doctor took time to listen, doctor's concern with comfort, all resulted in the 90th percentile. Patients described their experiences as amazing and awesome, adding, "I feel like the doctor was right there." And this is the best hospital in New York City. Limitations of this study were that the data did not describe the population that actually participated and if there were language barriers or not. Recommendations for a future study include implementing the service in other New York hospitals and in other metropolitan cities in other states. This will allow comparison of more than one functioning program, and results can be based on a national basis. Results, implications, and applications. The review of several scholarly articles selected revealed that telemedicine is ever-changing, not just nationally but internationally as well. These studies were conducted throughout this paper, revealed positive feelings towards moving forward with the use of telemedicine. Telehealth networks will expand internationally to other countries. Telehealth can bring positivity to many different people across the world. This includes those in rural areas, incarcerated individuals, patients with financial difficulties, and third world countries. Telemedicine, used to provide patient education between physician and patient, will continue to grow into the homes of patients. With this in mind, healthcare personnel will need to adapt to the ever-changing healthcare system that is rapidly growing to provide patient care. An increased number of qualified healthcare personnel will increase to provide care. In conclusion, there are many forms to deliver healthcare. With technology changing daily, healthcare takes a change with it as well. Telemedicine has been proven to be preferred by patients over face-to-face meetings. Feasibility and accessibility have allowed patients to take advantage of this form of delivery system. Telemedicine offers a lower cost to receive patient care. Growth will continue and expand to international regions in hopes of delivering patient care to those that may otherwise not have access to health care. Emergency departments will continue to expand and provide patient care to those who are less acute in the emergency waiting areas with faster treatment times and higher satisfaction rates. Telemedicine works and has been taken advantage by many.